I'm Dr. Divya VC, Associate Professor from SRM Kattankulathur Dental College and Hospital, and happy to be a co-author of a recently published paper titled Betel Nut Sweets in Children, The Bitter Truth, published in the British Medical Journal along with my guide, Dr. N. Vivek, Dean, SRM Kattankulathur Dental College and Hospital. This paper highlights about the growing problem of betel nut chewing, also called areca nut, supari or pan, among children. Betel nut is a highly profitable cash crop of our country, and India is the world's largest producer and consumer of betel nut. Although it is a culturally accepted habit, it has several consequences with prolonged use, which are often overlooked, and some of the consequences are discussed in this paper. To put it in a nutshell, besides causing oral health problems such as oral cancer and potentially malignant disorders, prolonged use of betel nut causes neurological problems such as addiction and dependence. Moreover, there is an increased risk of addiction when the habit is initiated at an early or a young age. Additionally, use of betel nut has been linked to ADHD, attention deficit hyperactivity disorder, in children. When used during pregnancy, it has harmful consequences on the developing fetus as well. This growing public health problem of betel nut chewing among minors and the easy access they have to it calls for regulatory measures and awareness creating programs to protect them from this harmful habit, thereby protecting our future generation. SRL is an AI-powered platform, a government initiative developed under support of the ANRF, Anusandhan National Research Foundation, with the primary goal of democratizing research. Research papers with valuable insights are converted into simplified forms by converting them into engaging formats such as videos, presentations and podcasts to reach more people, thereby creating a bridge between the scientific community and the public. Moreover, additionally, these contents can be converted into various Indian languages, thereby aiding meaningful knowledge dissemination, fostering further research and creating public awareness. Our prestigious institution, SRM Institute of Science and Technology, has several impactful research publications and patents which have been converted through the SRL AI platform. Especially recently, some of the top papers have been selected and published, and they will be shared.
Welcome to this presentation on betel nut sweets in children, the bitter truth. This research was conducted by Divya VC and published in 10 September 2025. Today, we'll explore the key findings and contributions of this important work. Let's begin by understanding the problem this research addresses. Betel nut consumption among children is a growing problem, particularly in India, a major producer and consumer of betel nut. This culturally accepted habit, often facilitated by child-appealing packaging, carries serious health consequences. Dentists in India frequently observe oral lesions linked to betel nut chewing, which increase the risk of oropharyngeal cancers and precancerous conditions like oral submucous fibrosis (OSF). This paper is a commentary or opinion piece discussing the findings and implications of existing research on betel nut consumption in children. It synthesizes information from cited studies to highlight the health risks, contributing factors, and the need for intervention. The methodology involves reviewing and referencing scientific literature from various sources, including studies on oral health, prenatal exposure, and neurodevelopmental disorders in children related to betel nut use. The consumption of betel nut sweets in children is associated with several serious health issues. Oral lesions, including those that elevate the risk of oropharyngeal cancers and oral submucous fibrosis (OSF), are frequently encountered by dentists in India. OSF has been documented in children as young as 2.5 years. Contributing factors to childhood betel nut use include low awareness, familial and peer influence, affordability, and accessibility. The pervasive issue of betel nut consumption among children demands urgent attention. The cultural acceptance of this habit, coupled with appealing packaging, masks its severe health implications, including increased risk of oral cancers and OSF, which can manifest even in early childhood. The lack of cure for OSF underscores the critical importance of prevention through education, family vigilance, and outreach programs such as school dentist visits. Betel nut sweets pose a significant and often overlooked health threat to children, leading to oral lesions, precancerous conditions like OSF, and potential neurological issues including ADHD and addiction. Prevention through education. Family involvement and professional vigilance, particularly by dentists, is paramount given the absence of a cure for conditions like OSF,